kind of coverage, and this kind of coverage cannot be specialized for your own individual attention and needs. Also, if you're a small business and before the reform you have decided to save your funds, instead of using them to pay for health insurance for all your employees, and you decide to keep it for funds of other administrative costs, you would not be able to do so now. In addition, you would have to pay a $750 fine annually for this action. Another loss that we can see is a loss of time. Currently, the wait times in ER emergency room visits have been long enough, but if everybody has health care and has the coverage that allows them to go see their doctor, the wait times can become tremendous. For example, in Massachusetts, the only state so far to have universal health care, reported a 7% increase in ER visit wait times just between 2005 and 2007, 2 years alone. Other than these kinds of losses, we can see losses financially for our nation, and Amy will detail more on.
Thank you, Deborah, for that introduction. I'm going to start off by saying that small businesses are less likely than large employers to be able to provide healthcare insurance as a benefit. At 12%, healthcare is the most expensive benefit paid by U.S. employers, according to the U.S. Chamber of Commerce. Some economists say that these high dollar figures place a heavy burden on companies doing business in the United States and can put them at a substantial competitive disadvantage in the international market as well. For large multinational corporations, paying for healthcare costs presents an enormous expense. General Motors, for example, covers more than 1.1 million employees and former employees. And the company says it spends roughly $5 billion on healthcare expenses annually. General Motors also says that healthcare costs add between $1,500 to $2,000 to the sticker price of every automobile that it makes. In the 2008 congressional discussions, the financial bailout to GM and Chrysler faced major roadblocks because providing healthcare benefits to their employees are just so high. And to increase those benefits with this new healthcare reform bill would really financially burden these companies. Although the Congressional Budget Office found that the final law would reduce the federal deficit by as much as $138 billion by 2019, the whole healthcare bill costs $940 billion, which is adding to our federal deficit. The Centers for Medicare and Medicaid Services, a U.S. government agency, also found that the legislation would do little to stem the rise in healthcare expenditures, and this is expected to increase to more than 20% of GDP in the next decade. These changes really affect the way businesses operate, and businesses have to restructure how they offer insurance to their employees. And insurance companies have to completely redo their premiums and may very likely incur more losses because of this change. In addition, there is an individual mandate. In 2014, everyone must purchase health insurance or face a $695 annual fine. However, some might choose not to pay for this annual fine, and they'd rather not, because they may not be able to afford the insurance in the first place. This could defeat the purpose of the healthcare reform bill. And William now is going to talk more about financial negative effects.
So, where are we going to get all this money, the $940 billion? Now, for one thing, the answer is more new taxes. These new taxes will affect both businesses and households alike. For example, medical device makers will now have a 2.9% excise tax on all their products. Families earning more than $250,000 a year will also have to pay higher Medicare taxes. As a result, the bill may promise to benefit millions of poor Americans. However, it will hurt investment and consumption by the American people. As we know, the middle and upper class make up a very large percentage of consumption in the United States. However, an increase in taxes will decrease such consumption, causing production to fall. Now, this fall in production will create more unemployment as companies are forced to cut back and lay off production and factory workers. Now, these production and factory workers are often of the lower class, so the bill is actually